Hello, my name is Erica Slusser, and this is my presentation for Healthcare Policy Analysis, titled Improving the American Health Experience Today. Thanks for watching. Healthcare in the United States encompasses a wide spectrum, ranging from the highest quality, most compassionate treatment of those with complex illnesses to the turning away of the very ill because of lack of ability to pay. From well-designed protocols for prevention of illness to inappropriate, high-risk surgical procedures performed on uninformed patients. While the past decades have been witness to major upheavals in healthcare, one fundamental truth remains. The United States has the least universal, most costly healthcare system in the industrialized world. Unlike most developed nations, the United States healthcare system does not cover its entire population. In fact, the United States does not have a healthcare system at all. It has multiple systems and no coherence. The elderly are covered by Medicare, which is federally funded. The poor are covered partly by the state and in part federally funded by Medicaid. Those who work can get healthcare insurance through their employer, and according to Census.gov, in 2020, 28 million Americans didn't have health insurance coverage at all. In order to correct the weaknesses of the healthcare system while maintaining its strengths, it is important to understand how the system works. What is high-quality healthcare? Well, it's care that assists healthy people to stay healthy. It's care that cures acute illnesses, and it's care that allows chronically ill people to live as long and fulfilling a life as possible. To receive quality care, we must first have access to it. We need scientific knowledge, well-educated, competent healthcare providers. We need separation of financial and clinical decisions. For instance, no Americans should ever be turned away because of an inability to pay. And we need healthcare organizations focused on maximizing quality, person-centered care. Most people consider healthcare a basic human need. Financing and organization of medical care in the developed world spans a broad spectrum. Most developed countries, the preponderance of medical care is financed and delivered in the public sector, unlike the United States, where care is primarily private. For instance, in Canada, healthcare is considered a fundamental right. Canadian healthcare costs are lower than in the United States. Canadians have universal access to healthcare without financial barriers, adding to the overall well-being and health of the nation. Canada's universal insurance program has created a very equitable system for distributing health services. Additionally, in Japan, the government boasts that their high life expectancy, 87 years for women and 81 years for men, is in part due to their excellent and affordable healthcare system. Japanese live a very healthy lifestyle, which complements preventative health measures. Their system is cost-effective, extremely equitable, has proven results, and is one of the best in the world. Although culture and other variables must be considered, overall, the United States has lessons to learn from other countries' healthcare successes and failures. Universal care and strong preventive presence with increased support from primary care providers does seem to be a common denominator of success. In 2010, President Barack Obama signed the Affordable Care Act into law. The Affordable Care Act's main intent is to increase the number of Americans with insurance coverage, expand Medicaid, and to change the way certain medical decisions are made. Though very controversial, the Affordable Care Act has improved health insurance coverage for Americans and has led some physicians and other care providers to change the way they provide care. For instance, a study done in pediatrics by Boston University Associates shows that since the passage of the Affordable Care Act, well-child visits have increased and out-of-pocket costs for their families have been reduced. So what can we do now? Personally, I'd like to look at what is working and expand on that with the support of the public. Work on lowering costs, improving transparency for both patients and providers, expand on preventative care and population health, and use technology to our benefit. I think gaining the public's support with what is working will help us make more difficult decisions with their trust and support in the future. There are many ideas for lowering healthcare costs in the United States. Some examples include, first and foremost, money can be saved on medicines. There's currently little regulation on prescription medications, and there is ample room for improvement here. Next, we can utilize our primary care providers for preventive care and to avoid costly hospital visits. Also, they're good for overall well-being. Improving population health is another way we can save money. For instance, obesity is a known contributor to chronic disease and costly healthcare needs. Finally, updating our outdated fee-for-service payment system would cut back on unnecessary services and tests and help save money. Committees made up of government policymakers, economists, and physicians could form regulations to help keep prices low as well. The need for and cost of healthcare services are unpredictable. Most people do not know if or when they may become severely ill or injured, or what the cost of care will be. Giving healthcare consumers more information and simplifying the system for administrators and providers saves money. It makes things more understandable for patients and providers. Focusing on obtainable goals could build public trust and support during these times when people have little faith in our government, as well as improving public trust in the healthcare system and patient-provider relationships. The Affordable Care Act mandated improvements to the way information is exchanged via electronic health records. In addition to improving access to medical records, use of technology in healthcare provides countless opportunities for improving our healthcare systems. Medical technology has the ability to reduce errors, improve outcomes, make diagnoses, provide treatments such as less invasive robotic surgeries with shorter recovery times. Telehealth is another electronic form of medicine that increased in popularity during recent years, in part due to the pandemic. For instance, most rashes can be diagnosed with a digital picture, yet these kinds of services don't exactly fit into our current fee-for-service system. However, telehealth has enabled doctors to provide services via email, text, video, and virtual consults. This is especially helpful in rural areas where access is often limited. I believe there is still hope for our home healthcare system. America has the talent and the resources needed to be among the other leading countries in healthcare. With the right leadership, possible bipartisan support, and maybe collaborative efforts between healthcare providers, payers, and policymakers, I believe America can catch up from behind.